The last disorder for this hour will be the tic disorder. What are tics? And what is a tic disorder? When we talk about a tic, we are referring to that sudden, that rapid, that reoccurring, the non-rhythmic motor movement or vocalization that somebody engages in. So you can be working on your motor, working on vocalization. Tics occur in two major groups. You can have simple tics or complex tics. When we talk about simple tics, we are talking of those sudden, those recurring, those non-rhythmic motor movements or vocalizations that have a very short duration. They only last milliseconds. This can include things like quick blinking, shoulder shrugging, extension of extremities. And then we have the complex motor tics. The difference between simple and the complex motor tics is the duration. Complex motor tics are of a longer duration. Instead of milliseconds, which we saw in the simple tics, now we are talking of seconds. And usually, complex tics include a combination of those simple tics. For example, there will be that simultaneous turning of your head and then shrugging of your shoulders, maybe concurrently at the same time. So two major categories: simple, very short duration, and complex, a longer duration. When we look at tics, we can also categorize them into four major groups. The first group is what we call the Tourette's syndrome. This seems to be a very common group that is known by the majority of people. Tourette's syndrome has its onset, of course, before the age of 18, and it is characterized by both motor and vocal tics. And then those presentations must persist for at least 1 year before you can finally say, yes, this person has Tourette's. Both those motor functions and the vocal functions. Remember the non-rhythmic, those instant presentations lasting for 1 year. Number two, we have the persistent motor or vocal tic disorder. This is also known as chronic. Think about something that is chronic. It has been there a good while. It is constantly presenting itself. It has become the order of the day. Persistent motor or vocal tic disorder only shows either motor or vocal tics. And those that present themselves must also persist for more than 1 year. Our third category is the provisional tic disorder. Under provisional tic disorder, you may have motor and or the vocal tics present. So you may have a single occurrence or a multiple where you have both motor and or vocal tics. And then lastly, we have the category we call the specified or unspecified. Specified and unspecified categories. Remember, specified category, this is where you have most of the signs and symptoms, but you don't meet the full criteria for that categorization. And then the unspecified, that is where you don't meet the full criteria, but the doctor does not necessarily have to tell you why you don't fall under that category. That usually happens when there is insufficient information for them to make a diagnosis, for example, in emergency case situations. Complex tics can appear to be very purposeful. In fact, many times people have looked at individuals who have tic disorders and thought that they are doing everything that is going on purpose. For example, we have what we call copropraxia. This is where an individual engages in sexual and obscene gestures. Easy to think those are purposeful. And then we have echopraxia. Those are tic-like imitations where you imitate someone else's movement. So think about it. A child comes into your office. You are going around your business. When you move to the front, you see a young little fella moving with you to the front. You make a left turn and there is that little guy making the left turn again. You move backwards without knowing you also have little somebody right there moving backwards with you. Echopraxia, imitating one's movement. And then C, we have echolalia. Echolalia meaning you repeat the last words or phrase that you hear. Before you understand that a child who is doing that has tic disorder, it can look very annoying. Can you imagine for every phrase or sentence that you say, somebody is repeating that last phrase? And lastly, fourth, we have coprolalia. This is where one utters those socially unacceptable words. Mostly they will include obscenities. There will be those who will be engaged in the ethnic, racial, or religious slurs where they cannot just stop. Those are examples of the complex tics that may appear purposeful. There are two major risk factors and prognostic factors that have been associated with tics. Number one is temperament. Tics are made worse, especially with excitement, with anxiety, and exhaustion. So once a child has been busy, heavy task, heavy work, that is when you find the tic activities on the increase. And number two, the environment has been implicated with that. When one observes gestures, when one listens to sounds of somebody else who has tics, it is possible for them to copy, it is possible for them to simulate, it is possible for them to begin to make those similar gestures. What are the differential diagnoses for tic disorder? When a patient walks into your office and they have a tic disorder, what will it look like? Some of the differential diagnoses will be the abnormal movement. It is going to be accompanied, of course, with what looks like other medical conditions. Because there are stereotypes, sometimes you may think this person simply has some motor stereotypes. You may think those are just normal, involuntary, rhythmic, repetitive, those unpredictable movements. And sometimes you may think, yes, it maybe is a chorea movement, meaning it is rapid, it is random, it is continuous, it's abrupt. It is usually bilateral, and so that can throw you off. Other times you may think, oh, it really looks like dystonia. This person has those simultaneous, sustained contractures. And those contractures are both agonistic, they are also antagonistic. Those muscles are engaged. You may look at them and say, yes, in fact, they're resulting into this distorted posture. That is a very clear differential diagnosis that you can easily fall for. And then there are other times when somebody who has tics may simulate somebody who literally has a substance-induced dyskinesia. And other times, because of that repetition, because of the constant occurrence, you may think, yes, they have OCD. You may say, yes, they are suffering from their compulsions, they are suffering from obsessions. or something that is very, very related to that group of OCD functions.